I'm happy to talk about BPDCN because it's a high clinical need in this rare entity. First of all, the awareness is a factor that needs to be raised. We have a cutaneous manifestation which often leads diagnosticians to wait and sit and have a hard time diagnosing this disease. In fact, it behaves like an acute leukemia, and there's no approved therapy until recently. And we have a substance, a fusion protein, that's called Tagraxofusp, approved in the United States by the FDA for primary, first-line, and relapsed refractory patients, adult and pediatric. And about 2 years later, the EMA approved it in Europe for first-line and adult patients only. The so-called Expanded Access Program, EAP, of this substance, also called Elzonris, is a part of a series of programs of registries and trials in this entity, because this has been under-addressed due to its rarity, and also with an overall survival of 8 to 10 months. On average, it is a poor prognostic disease so far. The patients are often elderly and not eligible for an allogeneic transplant. Standard of care is usually an acute leukemia protocol that the patients are being induced with. So Tagraxofusp gives the opportunity to go into the therapy with a milder approach and has proven to have significant response rates and transfer patients into an allogeneic transplant, which formerly probably would not have been eligible due to the fact that they could not have handled the polychemotherapy induction. The presented pilot multi-center retrospective analysis of efficacy and safety of Tagraxofusp is probably going to be updated in a series of reports or presentations at several meetings. The first 15 out of 76 patients in total that had been included into the program over a period of about 2 years are being presented at that poster, which had been presented orally on Friday. And I can say that we see encouraging efficacy and encouraging safety data so far. Of course, low patient numbers thus far. We are in the middle of recruiting. Hope to be able to present more details on this later down the road.